And so, good morning, Commissioner. It is, what is it now? Monday, May 25th. We're celebrating Memorial Day. How are you?
Doing all right, Ken. How are you? Monday mornings are different, especially when they are a part of a holiday weekend. Usually I'm sending a quick message to our folks at the Caroline and at the facilities, thanking them for working so we can be home. But I also want to take this minute because it is Memorial Day to just give a little bit of a reflection to the service members who gave the ultimate sacrifice in their life in service to our country. That's what Memorial Day is all about. And I want to, even in the midst of a pandemic, remember that that's the reason why we have the day off. In the newsletter last week, we highlighted the fact that at our veterans home in Rocky Hill, there have been 3 veterans who survived war but lost the battle to COVID-19. So we want to, memorialize them, but also recognize the fragility of life as it relates to this pandemic, and that's pretty sad.
Absolutely. And I think we also heard, Commissioner, an extremely uplifting story that Commissioner Sadi
Mm,
told us that I believe the veteran was over 100 years of age who
right.
had COVID-19. Here is somebody who fought for our country's freedom,
Yeah.
came back, now in his late stage of life, had the virus, but has survived and is now back at the VA home. Over 100 years of
Incredible.
age.
Yeah, it was incredible. Commissioner Sadi over the Division of Veterans Affairs is an active duty right now himself. And, I couldn't be more proud of him and how he's led the department here in Connecticut over Veterans Affairs. So shout out to him and all of the folks over at Division of Veterans Affairs that are working super, super hard all the time, just as our staff are.
Absolutely. And Commissioner, midweek, I think we were equally as inspired when we participated in the adolescent virtual town hall and
Yeah.
received just some great insight from our youth in care.
Yeah, we're always inspired when we take the time to listen to our teenagers and older youth. And the group that we have assembled through our YAB or youth advisory boards know that the mission that they have is an important one because not only are they letting us know what's happening with them in the moment, but they're shaping the next generation of how we do this work with kids in care that maybe older teens or transitioning to young adulthood. And we got some really great insights from them as they think about how they've navigated the social isolation of pandemic kind of quarantine and thinking about ways that we could help them celebrate some virtual milestones that ordinarily would have had a huge collective celebration, but now it gives us an opportunity to say what really makes sense in terms of connecting our teens and young adults to the people and circumstances that will help highlight some of those achievements.
Yeah. I think there's just no voice like the youth of our the
None,
voice of our youth.
none.
They were tremendous, and we also want to give credit. I think it was to Carlos, who
Wasn't he great?
he was
He and
really great.
Janelle from Our Piece of the Pie, who's our community partner, who helps with just some of the behind the scenes. And, everybody in the Transitioning Youth for Success division did an excellent job of pulling that teen town hall together. But they did a phenomenal job just navigating and facilitating. And then our youth, Maria Kelly, who's at UConn right now, talking about what that's been like for her during this virtual environment. So it was a really, really great event. We had a couple legislators on,
We
really
did.
nice.
We did. So I think there's future ones planned, and that those will be very timely.
Mhm.
And the theme there was the virtual town hall. In our weekly memo, we are going to include a link to really a great document that our Bureau of Child Welfare put together that
Mhm.
encompasses guidance pertaining to virtual assessments, visitation, supervision. Can you talk a little bit about that?
Yeah, so we've been at this since the beginning of March. One of our first videos with each other giving some updates to staff was in the beginning of March. We are approaching the beginning of June. Look at how quickly May has, almost slipped through. And we have had an opportunity to think about different ways of doing this work. Have they all been perfect? No. Have we, do we have an opportunity now to assess how we do our work? Yeah. And some of the things that we have had to do in this virtual or remote environment have been collected into a document to help give a comprehensive way to have staff have one place to go and get how to find access to resources, how to assess for intimate partner violence, how to continue to do substance use assessments, or how do you supervise remotely. All of those things collectively in one guide have been put together by our Child Welfare Bureau, and it turned out to be a really nice document. So we'll connect the link of it to this memo.
Great. This week also allowed us to receive feedback from the 4 co-chairs of the subcommittees that were providing information as the department moves towards resuming full operations. And that spurred a number of conversations.
Yeah, this has been great. We had to go into a virtual environment pretty quickly. Whether we were ready or not, the state, the country, and internationally, we had to move quickly into ways of communicating with each other that were not face to face. So coming out of that or resuming full functioning, we've gotten a little bit of a head start. We have an opportunity now to really think about and hear from our staff across the department on ways that they can continue either in a virtual environment, lessons learned, or things that absolutely cannot be done remotely. So what we asked for and what we got were responses to our dedicated COVID-19 mailbox. We got people who raised their hand and said, I'd like to be a part of some of these committees that we put together. And so our first crack at starting to craft some recommendations related to resuming full functioning took on 4 domains. That's physical safety, medical and wellness. What was the third one? Psychological and emotional safety, and then personnel matters, in that order. And the reason why I want to make sure that we say those in that order is because you can't really have psychological safety. You can't feel great about coming back to work if you don't feel like we have addressed the physical issues or the medical issues like screening and temperature taking and those types of things. So we've been working really hard to get feedback from all of our staff through the COVID mailbox, through those 4 work groups. We had over 200 people between the number of people that responded to the COVID mailbox and the number of people that we had on each of those subcommittees, over 200 different voices from different parts and functions of the department, just lending not only I wouldn't say that they were just ideas. It was really critical thinking and problem solving of what we could bring to the table to, use as we move the department forward. And so at the same time that that's happening, we're also convening external stakeholder groups with our, there's a legal division one that's, addressing some topics related to permanency barriers to limited court operations. There is the statewide advisory council that's pulling together the voice of parents and other people with lived experience. You have, providers that are providing us with some feedback about how we can resume operations. So there's lots of moving parts, lots of information, and ultimately an opportunity for the department to say what it needs in order to start to resume full operations.
And just to confirm, there are no final decisions made.
Right.
You have not set a date on when staff are going to begin coming physically back into the office. We are all eagerly awaiting initial data from the state reopening this past week, and allowing residents to have more freedom, certainly within our communities. So there's a lot of decisions that have to be made that will be made incrementally. But I think one of the biggest pieces of feedback we did hear was that staff wanted to ensure there was consistent and clear communication regarding not just what's going to happen, but the why. And I think you've certainly committed to memos, weekly videos, and being as transparent as possible. So not just the decision is understood, but the meaning behind it is clarified as well.
That's right. And, again, when we started these videos, I made it really clear that our primary mission was to balance the needs of our staff, the safety and support of those that work for the department, along with the needs and assessment of children and their families. Our kids and families, okay. We do know that there are elements of this virtual environment that are working well for our staff. But what I don't have a really good handle on right now is how well our families are faring during this time. And that's critical because it's our job to make sure that children are safe and that we establish ways to measure that in real time. And so, while we don't believe that the sky is falling and we know that children are resilient as our families, we know that many of our families know how to navigate crisis, and our communities have been lifting them up through, whether it's food distribution or additional ways of assessing whether or not someone just needs a break. We continue to get calls and hits to our talkitoutct.com website, which is an opportunity for people who have, just expressed a little bit of stress or anxiety related to parenting during a pandemic, that we know that people can look at the website, talkitoutct.com, and, speak to someone who can just help them decompress. We know that all that is happening, but we need to know what the experiences have been with children and families during this time as it relates to our mission. So the why is because we have a job to do, and the how is still being determined. Most of us have been working really hard throughout this time period to whether it's modifying the work that we do or doing it in very different ways. But I need to know a little bit more about how effective that has been. And so over the next couple of weeks, we'll start to glean some of that data to be able to make some more informed decisions.
Great. Great. So I think at this point in the video, we are going to discuss the specific numbers of foster parents, youth, and staff that have tested positive for the COVID-19 diagnosis. So if staff want to shut the video off, now would be an appropriate time to do.
And so if people are leaving us, whether it's to go outside and get some fresh air because it is still a holiday weekend, I do, before we get into the data, want to remind everyone of their responsibility to still be vigilant. Social distancing, wearing masks when you're in public, making sure that you continue with your really strong hand hygiene and covering your mouth or nose if you sneeze or cough. It's allergy season. We want to make sure that people are just safe and not getting relaxed here. It's been quite some time. We're entering into the third month of this, and we can't we can't slack off. We really have to make sure that we maintain all of the things that have kept us safe thus far.
Absolutely. Absolutely. So specific numbers, we have 56 foster parents who have been diagnosed at some point with COVID-19, 10 youth, and 32 staff members, of which 27 have returned back to work.
Right. So as we finish up Foster Care Appreciation Month, we want to recognize the extra efforts that foster parents have put forth during this time. And, by those numbers that you just indicated, we, have to recognize that some of our foster parents have experienced health-related concerns. We are busy working not only with our FASU and regional staff here, but also with our therapeutic foster parents associations to really try to make sure that we support foster parents during this time, particularly those that have had some health concerns themselves. We had the 2 foster parents that passed away during this time. That reminds us of the fragility of life as we kind of started today's video talking about, and it really impacted our foster care ranks as well. The children's number, the children diagnosed positive, is also something unique. You heard earlier in the week, we put out a memo related to the syndrome that is impacting children across the country and across the world that our medical division is watching really, really closely. So those 10 children that have tested positive, 8 of those are in congregate settings. And this particular syndrome that's impacting kids typically manifests itself after a COVID positive diagnosis. So our medical division is watching children really closely following the positive diagnosis. These 10 that we talked about, as well as all of the children that we have in care, to assure that we're getting kids seen by their primary care physician during this time. And then lastly, we are encouraged that the trend seems to be slowing down at the number of staff who have contracted the virus through community transmission mostly, and that some of them are recovered, most have recovered, and many have returned to work already. So we're moving in the right direction, but by no stretch of the imagination are we out of the woods.
Yeah, yeah. And as we typically say on the videos, we're going to have another busy week. We know that. I think the collaboration and the teamwork across the state has been just tremendous. So that being said, we hope you get some rest and are also taking care of yourself, Commissioner.
Thanks, Ken. I give that right back to you all. We are working really, really hard, and we do want to make sure that we take some time to appreciate not only each other, our coworkers, the highlights to veterans this Memorial Day weekend, and just to our country as a whole. We're going through it, but we're going through it together.
Well, have a great week, and
Thanks.
we'll talk soon.
All righty. Take care, Ken.